related conditions. If niyakumbula nonke, we had, of course, kwisonto elindlulile Dr. Noko Tabedi Tlabela, where she was telling us about anxiety and depression. Now today we are indeed closing our series on mental health problems and conditions, Sivala Kekanti, with a topic that is really not talked about much, and it is called substance-induced psychotic disorder. So we're talking SIPD. Now, Babugeli Emakaya, before we get into the topic of today, I just want you guys, this is the time where, you know, each and every single one of us, you are texting your friend, uyamfonela, maspitu, uyamjela, Holistic Healthy Living is currently live on GNF TV. Please do share Babugeli Emakaya, like, and get out your writing pads, record umangabe. You're the type that wants to record, because it's about to get lit. We are getting into our topic for today, psychosis, right? We're talking about substance-induced psychosis. Now, abaningi bayamangala ukuthi, why are we talking about substance-induced psychosis under mental health conditions? Because it is indeed a mental health condition. Now, what is substance-induced psychosis? Well, this is the definition, right? So according to the National Alliance on Mental Illness, they define psychosis to an episode in which an individual has a break from reality. So it's an episode where an individual has a break from reality. And this includes, but it doesn't require hallucinations or delusions, okay? And then about 3 in 100 people. So in every 100 people, about 3 of them, so that's 3%, will experience at least one episode of psychosis in their lifetime. So imagine if we were in a room and there's 100 of us, at least 3 of them will experience psychosis once in their lifetime. Now, drug-induced psychosis, also known as substance-induced psychotic disorder, is known as a psychotic episode that is related to the abuse of a substance, right? So Lana, these people, they experience psychosis related to an abuse of a particular substance. And very, very important, substance-induced psychosis is a mental condition, which means it needs to be treated as such. It's not just in layman terms, this person has a mental condition and this condition needs to be treated. The same way, if they have a medical condition that needs to be treated. Substance-induced psychosis is a mental condition that needs to be treated. Now, how, right? How does one get a substance-induced psychosis? Number 1, this can occur from taking too much of a certain drug. So if you're taking a particular drug and you're taking too much of that drug, that can cause substance-induced psychosis. Secondly, having an adverse reaction or a side effect after mixing substances, that could also result in psychotic-induced psychosis. Substance-induced psychosis. Number 3, during withdrawal from a drug. You were using a drug for a certain amount of time, you've developed dependence to that drug, and now you've stopped the drug, and because of stopping the drug, you were having what we call withdrawal symptoms. People that use, for example, nyaube, the word on the street is hupahluha, you know. So because of withdrawal from a particular substance, you could be experiencing psychosis. Or if the individual has an underlying mental health issue. Now, those are ways that one can develop this, right? And remember, once again, substance-induced psychotic disorder, it is a mental health condition, right? So it's something that needs to be treated. Now, what are the symptoms? Sibona ngani ukuthi umuntu has got a substance-induced psychotic disorder? Wow. Firstly, not everyone will experience a psychotic episode the same way, right? So a psychosis yaga person A may be different to a psychosis yaga person B. But there are certain characteristics, certain things that Umasi is born, they let us know, that this person might be having a psychotic episode. Number one, it includes hallucinations. Now, hallucinations can be including hearing, seeing, smelling, or tasting things that are not present. So with hallucinations, you are hearing, you are seeing, you are smelling, or you are tasting things that are just not present. Remember, we said psychosis, there is that break from reality. You can't differentiate between reality, what is real, and what is not, right? So Gubo, these things that they're seeing or they're hearing, it seems real. But when on the outside, you can clearly see, Mara, there's no one speaking. Yet this person might be saying they're hearing someone speaking. So hallucinations. Number two, delusions. Now, what are delusions? Delusions are fixed, false beliefs that persist despite the evidence of the contrary. So here, umuntu believes something. For example, a person may say they are seeing 5 people right here. That time, there's no one else. Mara, they will tell you, nango kala, nango is 2, nango is 3, nango is 4. And even if you can try, take pictures, take videos, try to show them, try to prove, ukuthi lente bayibonayo ayikho, they cannot. They believe it. So this false belief, it is fixed. And despite showing them that this is not true, it cannot possibly be true, they still believe it. So they're delusional. All right. And these delusions can be religious delusions, like Muntu Abenalo Guti Ena, they have powers from the supernatural or supernatural spirits and this and that, is showing them this and that or telling them this and that. So these delusions can be, religious delusions. They can be grandeur delusions where Umuntu thinks they are higher and mightier than each and every single person alive. They could be persecutory delusions where you're constantly thinking that people are plotting against you. They're trying to get you. They're plotting against you. Or, the police are looking after you. They want you, or those kind of, those are persecutory, delusions. Then, the problems here, it's they can't distinguish what is real and what is a fantasy, there is that break in reality. Right? So, and this could also include umuntu ukhuluma one or having conversations, this abrupt, disorganized behavior. Now, very important, sometimes psychosis is mistaken for aggression. People that are experiencing psychosis are not necessarily always aggressive. They don't always have the intent to harm another. They're just struggling with distinguishing what is real and what is not. Hence, harming someone else is very far from what they're currently doing or experiencing. All right. Also, how can psychosis present? One may have trouble taking care of themselves. They forget to eat, they forget to drink, they forget to bath themselves. They just, umuntu just keeps on hoarding things. You just don't, you don't let go of things. You're constantly hoarding things. Even, hoarding clothes, wearing a pair of clothes on top of another, on top of another, on top of another. You just don't want to take of anything, but you just want to constantly, continually wearing different things. Yeah. Secondly, paranoia and suspicion. And this could include suspecting loved ones. They are plotting against me. You know, it could be institutions that you're suspecting or other people that are harming you. So so when you are paranoid and there's just always this thing of, they want to get me. They're plotting against me. They want to steal or take away my job or take my life away from me or everything that I've achieved. You know, there's suspicion there and paranoia. And then also a difficulty in communicating clearly, right? You just cannot communicate clearly. This could also present with your disordered speech, but you can't even hear what they're saying, you know, or thoughts. You know, for example, you may ask a person, well, how was your day today? They will start. No, so today my day, actually, you know, I think the president, you know, wants me. They were just telling me that there's a big project. So they just completely off-ramped, you know. It's so tangential. So there's that, disorganized thoughts, disorganized speech. They're just all over the place. You can't really hear what they're saying, or they're having pressure of speech. They're speaking so fast and they're just not making sense. If you're seeing those things, that should be a call for concern. Next, hypersensitivity to sound, smells, and other sensory input. So, lo muntu lona, you know, exaggerated sense of smell, exaggerated sense of sounds. You know, mhlampe you're talking kahle, normal tone, normal volume, and then we receive it as you are being extremely loud, and they will suddenly be telling you, that time when ukhuluma kahle, but yena ukuzwa ngathi you are extremely loud, right? So it's that hypersensitivity to sounds or other sensory inputs. And then a flat effect or lack of emotional expressions. Lana umuntu is usually blunt, you know, they just blunt. They're not showing any expressions. You can't tell if they're happy or if they're sad, if they're okay or if they're not okay. They're just blunt and they're flat. And they may even have a monotonous speech, you know, da 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 da. And that's just how they keep going, da 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 da. Whether they are happy, whether they are sad. It's just all the same. Okay. Now, so Babugeli Emakaya, this is if you are seeing some of these things that we have mentioned here, then this could be a call for concern. And this loved one of yours is into certain substances. Now, what are the causes of substance-induced psychotic disorder? Remember, this one, it's in the name, substance-induced psychotic disorder. So there is a substance, right, that is the culprit, Lana. So it is caused by the misuse of alcohol or drugs. And which drugs do we usually find? So this could really be any, but the big culprits, cannabis, right? Cannabis, dacha, we usually find those, you know, you also get your nyawopes, you get your crystal meth, your crystals, your cocaines. So those illicit drugs, you know, you get your amphetamines, your methamphetamines, even benzos, it could even be alcohol. And now uyabuza la ukuthi, okay, so nangaphuza nje kayi-1 or just ngibheme kayi-1, then does that mean I'm going to get this psychosis? No. Remember, this is the prolonged use of these substances. However, we can't tell you ukuthi if uyisebenzise kangakanani or over isikhathi esingakanani, but the prolonged use. So if you are using dacha, sometimes people look down on, it's just some weed, you know, it's just some weed. And then you look down on people that, for example, be smoking nyaupe or are injecting or crystal meth and whatnot. But no, that's not it. Even just your weed, just your weed, prolonged use of your weed can cause you to have substance-induced psychosis. So illicit drugs, whether it's nyaupe, whether it's cannabis, whether it's meth, cocaine, whatever, right? As long as it's these illicit drugs, because they mess up with the brain chemicals, and that's why, because the culprit here is substances, of course, when we get to treatment, one of the biggest things that one needs to do is to stop the offending drug. Okay, now ke babukeli emakhaya, moving on to the risk factors, right? Now, what are the risk factors to getting psychosis, substance-induced psychosis? If you've had a previous traumatic brain injury or a stroke, risk factors to getting psychosis really. A family or personal history of schizophrenia, mood disorders or psychotic disorders, these are risk factors to getting psychosis, right? To being susceptible to getting psychosis. Side effects of certain prescription medications, especially your hallucinogens, your benzos, for example, you know, those that really alter our brain, yeah? Dementia, such as Alzheimer's disorders, brain tumors, lesions or cysts, and genetic abnormalities, right? All of these can play a role in this psychosis, right? There are risk factors to psychosis. Now, if you've got any of these risk factors, and on top of that, you are using these illicit substances, your chances therefore of getting psychosis, substance-induced psychosis, are even higher than someone without. Now, how do we manage it, right? So there's a combination of medication therapies and a support structure that can help put you on the road to recovery and better mental health. So I always say, here we need a multidisciplinary approach. It's not just a one way or one thing and it will fix all, but instead we need to put in the treatment together with support structure, together with therapy if needed. Zonke lezi zihlangene, they are what helps. Number 2, medication, right? So the doctors may prescribe certain medication to help with the psychosis. Right. This one is to deal with the symptoms that you are experiencing as a psychosis. That is the medication. Also to control any other symptoms, for example, that may be affecting this patient. Maybe there is psychosis together with depression or psychosis together with anxiety. We get to then add on to that medication for the depression or medication for the anxiety. Right. Then therapy. Babugeli emakhaya, I cannot stress the importance of therapy. Therapy is essential in helping to find out what are the triggers, what triggers these episodes, and how can we handle them? How do you manage them? Are there potential stressors, for example, that we need to that we can identify, and how do we deal or manage with those stressors? And also, you know, during these therapeutic sessions, we get to see, could we maybe need to treat this person as an inpatient? Do we need to then admit this person? All of this we get to uncover during therapy. And then also, as I mentioned lastly, very, very, very important, Babugeli, is support. Whether it's family support, the support of your spouse, but support is important. So, niyabona ke Babugeli emakhaya ukuthi in us dealing with this problem, we don't just rely on medication or just rely on therapy or just rely on support. Instead, mele sizihlanganise zonke lezi zinto to manage the condition. And of importance, with substance-induced psychotic disorder is to stop the offending drug. So if it is cannabis, because remember, what will happen is, now your patient is presenting with psychosis. But we draw some blood, we take some urine, and we check what could be, because is this a psychosis due to a general medical condition, or is this psychosis due to a drug, or is it just pure psychosis? So we then get to check ukuthi kunani in the urine, what toxins can we find? Let's say we find cannabis. In this patient, the important thing is to stop the cannabis, because it is the cannabis that is triggering the psychosis. If we stop the cannabis, the psychosis will go away. And in the case of substance-induced psychosis, the obvious cure is to stop the abuse of that particular substance. But in reality, this is often way more complicated. It's not as easy as, okay, for example, and I just stop. No, they've developed dependence. And when they stop, there's going to be withdrawal symptoms. We need to be able to manage those withdrawal symptoms such that they don't go back to smoking that drug. Hence, we then include programs, we include social workers, and they get to refer us or help us with getting rehab programs that can help with regards to stopping a particular substance that one was now addicted to. And remember, once one is addicted to a particular substance and now they're experiencing some mental illness or not, this can become unbearable, right? To the point where they just want to continue taking the substance, because when they're taking the substance, for example, they're not experiencing the withdrawal symptoms. When they're taking the substance, all is basically well. That is where the problem is. And so that is where our rehab programs then come into effect. And these rehab programs, they differ. Depending on where you are situated, there are different rehab facilities and centers. Amanye rehab program ama inpatient, meaning bayakuthatha uhlala lapho ulala lapho. Amanye, they are outpatient rehab facilities. For example, if you are around the Mtsweni area, there is a program called COSUP, and it was a collaboration between the city of Mtsweni as well as the University of Pretoria, and they came up with this outpatient program called COSUP, where they really help. It's a rehab program where they help qualifying candidates to stop the use of whatever substance that they are addicted to. And through that program, they get physicals, they get medical attention. There are also other organizations that assist, once, because it's one program, and for example, Lomuntu has successfully completed them, and they also get to help them with staying clean, also educating other peers, jobs, getting skills and whatnot. So there are such programs. So depending on where you are situated, definitely find out the different rehab programs that are there. And now what I would like us to quickly browse through Babugeli Emakaya, what are the myths, what are the myths as far as as far as psychosis is concerned? We're going to rush through this one very quickly. Myth number 1. People with psychosis are psychopaths. That is completely wrong. The fact is that there's a difference between psychosis and psychopathy. Remember, with psychosis, we said there's that disconnect, there's that disruption from being able to distinguish reality from a fantasy. And psychotic people don't usually have intent to harm or to manipulate, right? Whereas with psychopaths, psychopaths don't have psychosis, and they are at a higher risk of intentionally causing harm to someone else. Number 2, people that experience psychotic symptoms are dangerous. No, those that have psychotic symptoms are not likely to deliberately harm others. Myth number 3, it can't happen to you. The fact is, psychosis can happen to anyone. ayikhethi ukuthi uyasebenza awusebenzi, ufundile awufundanga. It can happen to anyone. Sometimes labe sebafundile, you know, they be like, oh no, it's just a weed here or there to calm my nerves. I'm not like someone, you know, who uses it every day and dependent on it. News for you. Even you can get substance-induced psychosis. It can happen to anyone. Myth number 4. People with psychosis have split personalities. The fact is, people with psychosis don't have split personalities. Remember, we're not talking about your identity disorder. Or no. If you have, for example, a dissociative identity disorder together with psychosis, then that's where we can get your split personalities, you know. But it's not that definitely moon psychosis, you have a split personality. Number 5, drugs can't cause psychosis. We just had a presentation on substance-induced psychosis. So definitely drugs are a common cause of psychosis. Number 6, psychosis is contagious. Or say if I get lana psychotic and there's someone next to me, no, symptoms of psychosis are not contagious at all. There is an underlying problem that is bringing about the psychosis. Hence, we need to find why and treat or manage that particular problem. Number 7, psychosis is caused by bad parenting. The fact is, psychosis is not related to one's upbringing. So, bazali emakhaya, let's stop being hard on ourselves. Ukuthi umntwana, for example, useyahlanya because of indlela akhule ngayo. Cha. But remember, there are things that can bring about that, you know, recreational drugs or environmental factors or stresses that can bring about that. Number 8, people with psychosis can't lead normal lives. That is completely wrong. There are many people that are living with psychosis and are leading normal and productive lives. As soon as you are able to manage the psychosis, for example, Babugeli, we mentioned there is medication that you can be on. As long as you're taking your medication, you can work. You can work just like anyone else. Believe it or not, in each and every single profession, you do have people with maybe psychotic disorders, some diagnosed and are on treatment and are well controlled. Remember, Bugeli Emakaya, you know, we're trying to break off these myths and these stigmas. Psychosis, it's a mental health condition, just like any other, a medical condition, just like any other. If it is treated, if it is managed properly, and it is under control, we do not anticipate any issues, nothing whatsoever, in leading a normal life. Number 9, people with psychotic disorders are crazy. If someone has psychosis, it doesn't mean they are crazy. So let's do away with such terms. It's us basically, you know, carrying on the stigma associated with psychosis. All right. Remember, during a psychosis, abantu they have hallucinations, delusions, izinto ezingalona iqiniso bona bazibona ngathi ziyiqiniso and kithi bese sithini uyahlanya cha. In their world, whatever they're seeing or saying, it feels true and it feels real. Number 10, psychosis is the result of a character flaw. No, psychosis is not influenced by any of our character traits. And then number 11, there is nothing that you can do to help a loved one with psychosis. That is completely wrong. But kuluma on how we manage it, and we said together with the medication and the therapy, support. Right. Always important. Be there for them. Help them to get through that phase, that disease, that illness that your loved one might be having. And psychosis can't be treated. That is the 12th myth. Several successful ways. There are several successful ways of treating psychosis. So, Babugeli Emakaya, we have come to the end of our education educational series today under mental health conditions, and we were talking substance-induced psychosis. Now, Babagili Emakaya, I believe you can now see, or there is a better understanding on, okay, so psychosis can actually be treated. Psychosis is not a life sentence or the end of your life. With support, with medication, with therapy, we're able to manage it, and this person can actually get to lead a normal life. And if there are rehab, for example, that is needed, there are many facilities and organizations out there that can be of assistance. You just need to know what is available in your area. So Babugeli Amakaya, this is to say to you, if you know someone, or you might be someone, or you know of someone in your community, in your family that might be struggling with this, help them to get help. You now know better, and because you know better, you are able to help better and show up better for your loved ones that might be experiencing linking Alena. So Babugeli Amakaya, we have indeed come to the end of our show, and thank you so much to each and every single one of you that have been watching. Siyaqala-ke ukuthi niqhubeke ni like our page on Facebook, Holistic Healthy Living. You go on Facebook, you just type in there Holistic Healthy Living. Please go on that page, like it, subscribe. If you have any questions, please put down your questions right there. And if there is anything, any other topics that you would like us to bring to you, please, Babugeli Emakaya, write them all down there, and we will be more than happy to present those to you. Remember, you know, the whole purpose of this show is to eradicate the lack of knowledge as far as health is concerned, because we understand that when you know better, you are able to do better. But if you don't know, you are unable to really make the right decisions or the right choices thereof. Secondly, Babugeli Amakaya, we always advocate for prevention. Remember, we say prevention is better than cure. And more often than not, you won't be able to prevent something you don't know about, which is why we bring these shows to you to teach you more about your health, so that you are better able to make decisions from an informed point of view. Babugeli Amakaya, sikhumbuzane futhi ukuthi your health is your responsibility. So continue doing the right thing. Stay tuned kulo lolu hlelo so that you can learn more about your health. And when umuwazi ngcono, you are then able to teach the person next to you, and eventually we can get to, you know, a community that knows more about their health and are taking better responsibility and decisions as far as their health is concerned. On my side, your host, Dr. Z Mtsweni, thank you so much for joining us. Aslanganeni futhi kulo isonto elizayo, where we will be starting our Women's Health series. You definitely do not want to miss this one. Siyatholakala once again on Facebook. You're finding us as well on GNF TV. Also, our YouTube live page. Continue to like and subscribe, and please, Babugeli Makaya, go on to a Holistic Healthy Living on Facebook, like that page and follow us for more. Thank you.